If you've placed your questions in the chat, we'll go through some of them now. You may also raise your hands if you'd like to ask directly. Okay, so let me just check. Okay, so our first question, Doc, from the chat. With insulin resistance being very prevalent, especially with type 2 diabetes, what actually happens to the body at the cellular level, and how can Celergen support the body in managing this?
Okay, so first, let's lay the groundwork for how diabetes develops. Okay, diabetes develops, or the acquired type of diabetes, diabetes type 2, develops when your body is exposed to so much sugars or carbohydrates that your insulin become ineffective in controlling it already. So there is a phase where your doctors will call you pre-diabetic, meaning regardless of what you do, your blood sugar is always in the higher ranges when you do your blood test. Pre-diabetic is more specifically referred to as what we call metabolic syndrome. Metabolic syndrome is an umbrella entity that covers including insulin resistance. Insulin resistance develops when your body is always exposed to high levels of blood sugar, that your insulin has to be produced more and more. So it loses its effectivity because your body always is exposed to high levels of blood sugar. You have to remember that sugar, when you eat it, when you ingest it, so it's absorbed in your stomach. The stomach is the only macronutrient the stomach digests is carbohydrates. That's why you have acid there. So incidentally, if you are suffering from hyperacidity or reflux, then look at your diet. It's mostly carbohydrates. So if you eat a lot of carbohydrates or sugar, your body has to produce more and more insulin to control your blood sugar. How does it do this? Insulin will unlock your cells so it can absorb the sugar that you take in. More and more sugar will grow will cause your pancreas, the organ that produces insulin, to go into fatigue. So this is very similar to what we call adrenal fatigue, wherein you are always stressed and your adrenals start producing less and less cortisol because its effectivity decreases. With insulin, it's the other way around. Your pancreas starts producing more and more insulin to control that ever high blood sugar that you expose your body to. So eventually your pancreas gets tired, you start you stop producing native insulin, and you are now dependent on insulin from the outside, which we call exogenous insulin. So you start injecting yourself with insulin. Fortunately, all of these things are preventable and reversible. So again, you keep hearing me say too much carbohydrates, too much sugars, then lessen your intake of carbohydrates, lessen your intake of sugars.
Okay,
I
thank
hope
you.
that answers the question.
Yes, yes, Doc. We have more questions. Next question, Doc. If hormonal decline is merely a manifestation of aging and hormone replacement does not alter the aging process, where does cell therapy fit in?
Okay, very good question. First off, let's correct. Uh, the proper kind of hormone replacement therapy should benefit and alter your rate of aging. Okay? The body ages faster when your hormones decline faster. So if you can top up your hormones by applying bioidentical creams, by injecting testosterone, so the proper kind of hormone replacement therapy can slow down aging. Okay. So cellular therapy, particularly with a supplement that helps your cells repair themselves, the first effect, incidentally, is you will notice your hormones become rebalanced. So for people who have been taking Celergen or the like supplements, unfortunately, there's no like supplement to Celergen, like I mentioned. Your cells start preserving themselves. And if your cells are getting more and more preserved as you age, your hormones go back to its normal function. You cannot do away, of course, with menopause. It's menopause and andropause happens because of the relative decline of your hormones. But at least you can maintain your hormone to a functional level or at a functional level wherein your hormones are always balanced. They're always adequate to provide whatever the cells need to power themselves to do your functions, your daily functions. So making sure that your hormones are properly balanced, not only at the right level or the right physiologic level, can really slow down aging. And that is actually at the cellular level. So yes, consult your doctor regarding hormone replacement therapy.
Okay. Thank you, Doc, for that. Okay, a question from Dory Apasible. After Ori left patella surgery, taking 3-Genacol collagen capsules before bedtime was prescribed. Will taking one Celergen capsule daily suffice for the speedy and full recovery of the Arif left patella surgery?
Okay, very good question. Let me start by saying or explaining ORIF means open reduction internal fixation. So, uh, Dory injured her knee by fracturing or breaking her kneecap, the patella. And what that entails is a damage on the underlying cartilage. And damaging your underlying cartilage hastens degenerative osteoarthritis. In fact, we call it post-traumatic arthritis. Okay. Usually, you are recommended to take collagen peptides, which is Genacol, which she mentioned, and the right dose is 3 capsules at bedtime. It's because when we sleep, that's when the body repairs itself. So you are providing, by taking Genacol at bedtime, you are providing your body with the raw material to regenerate your cartilage, especially if it was unduly or unexpectedly damaged or fractured with your patella. Uh, Unfortunately, it cannot compare to Celergen. They have different mechanisms of action. Celergen helps your cells repair its DNA and helps your collagen function better, but you have to have the collagen first for Celergen to take effect. Uh, is that clear enough? So, if you're asking whether you should take one or the other, I would recommend that you take both. Okay? Taking Genacol provides the raw material for cartilage regeneration. Taking Celergen makes sure that your body produces enough cartilage or goes through the process of regeneration more effectively. I hope that answers Dory's question.
Thank you, Doc. Another question, Doc, from Yunting. Can Celergen help with spinocerebellar ataxia? Understand that it's an inherited neurodegenerative disorder.
Okay. All diseases have a genetic or inherited factor. So we develop, for example, ataxia because we are prone to it genetically, but we also provided all the setup or setting for your brain to malfunction. Ataxia is when your motor functions become uncoordinated. Okay. So what your body is trying to do now that it has developed this illness or disease is to repair your nerve cells, particularly your brain, your motor cortex. Celergen can help. Okay. All diseases are multifactorial. There's genetics, there's environment. Celergen can help your cells repair themselves. Did that answer the question? It will not cure you of ataxia by itself, but you have to correct all the other factors and provide your body with what it needs to repair your nerve cells or brain cells.
All right. Thank you, Doc. Next question. I have heard of oral cell therapy that is extracted from animal placenta. Are these effective and how does it compare to Celergen?
Okay, there is no such thing as oral cell therapy because cells, when you take them, which these products claim, they will just get digested and broken down into base proteins. So what Celergen offers is it provides the raw materials that your cells need in repairing your cells. Okay, so taking deer placenta, for example, is not taking stem cells. It's not taking any cellular therapy. And what you are benefiting from at the most is that you have the peptides that these cells contain that are placed in a capsule. These peptides are from placenta, which is a developing organ, and thus are rich in growth factors. So that's what you're getting.
Another question, Doc. I recently been told to have osteoporosis with negative 2.6. I am male, 65, Asian. Is Celergen able to help? How long will it take to see results?
Okay. It's quite rare for a male to get osteoporosis. Yes, negative 2.6 is osteoporotic already. The negative 2.6 is a score. It's practically the T-score, which is a measure of standard deviation from the norm. So you are negative 2.6 away from the normal Asian 65-year-old. Uh, the passing is negative 2.5. So you're just barely there. So first you have to find out why you are osteoporotic. Like I said, it's rare for men. It's very common in women, particularly osteoporotic women, because bone metabolism in women is heavily dependent on estrogen, which they lose when they go into menopause. For men, we never stop producing testosterone, which is also important in bone and muscle metabolism. So there must be something that is causing you to become osteoporotic, which may need to be corrected. One of the most common causes for my osteoporotic men is nutritional deficiency. So you might not be getting enough calcium. You might be getting enough calcium, but your body is not absorbing it. You might be getting enough calcium and your body absorbing it, but it's not going into the bones. So all of these things are metabolic processes that, yes, Celergen can help correct.
What about arthritis, Doc? How can Celergen help?
Okay. Arthritis is a general term for any inflammation of the joint. Arthros is Latin for joint. Itis is inflammation, suffix for inflammation. So there you have dermatitis, you have neuritis, which are inflammatory conditions. Arthritis is, again, like any disease, a multifactorial in origin. So developing early arthritis, you might be overweight, you might be inflammatory with what you eat. There is such a thing as an inflammatory diet. And across the board, most people get inflammation from their diet if they have a lot of gluten and dairy in their diet. So you might have to look at these things. So uh, all diseases being a multifactorial condition, the major factors that influence the development of a disease is diet. It's usually genetic and environmental with all diseases, and that part of the environment which has the most impact on our bodies is one that we put inside it. So that's your food. So check your diet, check your weight, check your metabolism. Arthritis, again, is the failure of the body to heal itself. So pushing the body to heal itself, supplements do help.
Thank you, Doc. Next question. Okay, so someone suffering with from sciatica, would Celergen be of help to manage the condition?
Okay, again, like any disease, multifactorial, there are a lot of factors which lead to the development of sciatica. Sciatica is most commonly due to compression of a nerve root in your lumbosacral spine. It's either your disc, your bone spurs, or both. But this develops because your back is being exposed to stresses it is not conditioned for. So by saying that, the only thing that can condition your lower back is exercise. And the stress that you have to minimize that you expose your lower back to is your weight. So you have to look at these things again together with supplement. Yes, it can help.
Okay po. Next question, Doc. What age can one start to take Celergen to help the body?
Okay, the body practically starts degenerating at the age of 25. So this is not a hard and fast starting line. You may start degenerating a part or many parts of your body even while you are developing or in the developmental stage of musculoskeletal development. So this is not a hard and fast starting line. So you can start taking Celergen or any supplement for that matter as you go towards the tail end of your developmental phase, which is your later teens.
Next, Doc. Does Celergen have any effects on pulmonary hypertension, especially in the late stage? If yes, how does this take place?
You'd be surprised. Celergen can help the body recover from such injuries and insults. Pulmonary hypertension has an underlying cause. Usually it's pulmonary damage, usually it's heart damage, which is we call cor pulmonale, wherein you have a heart disease because you have high pulmonary circulatory pressure. So you have to identify first what caused the pulmonary hypertension, and then you correct it from there. Okay, that's a problem that we see now in our doctors. They we were all trained to cure or treat symptoms. Yeah, pulmonary hypertension, we give you decongestants, we give you blood vessel relaxers or relaxants. But the main reason why you develop pulmonary hypertension is not addressed. So go to a more conscientious doctor who will investigate why you develop your symptoms and what you're feeling, and discuss with him or her how you can treat the underlying cause of your ailment and not just the symptoms.
Thank you, Doc. From Miss Irene Lim, how does Celergen help a lupus patient who is on several medications at the moment to help manage the condition?
Okay, lupus is basically an autoimmune disease, and one of the highest turnover rate of your cells are your blood cells and your immune system. So fixing your supplementations, your diet, your lifestyle will immediately and heavily impact on your immune system. If you have a well-balanced immune system, there's no underlying cause putting this system into imbalance, then your lupus will also correct itself. Yeah. Again, if you notice, all the meds that are given to you are band-aid solutions. We give autoimmune disease patients steroids to dampen their immune response. It's like chemotherapy. You're not only killing the cancer, you're also killing the good cells. So by suppressing the immune response of the body, you take it further and further from normal functioning and balance. So, yes, supplements can help. The reason why you are suffering from an autoimmune condition such as lupus is because you have an immune imbalance.
Thank you po. Can Celergen help with progressive supranuclear palsy?
Okay. Like all the diseases that we discussed today or tonight, this is a multifactorial thing. You have to find out and address what caused your palsy. Okay. Usually, and this is something that a lot of doctors don't even look into. It's your medication which pushed you into that condition. So there are practically most diseases can be addressed by fixing your lifestyle so that you won't need medications, all of which have side effects that can cause another illness or another condition.
Okay po. Next, can Celergen be given as an alternative solution for elderly patients who does not want invasive surgery for arthritis or arthrosis?
It depends on the stage of arthritis. On the X-ray, we have a four-stage grading system initiated by Kelger and Lawrence. Stage one is when your knee, for example, your joint starts forming osteophytes or spurs, bone spurs. Two is when there is already a decrease in the blank space in your X-ray, which represents your cartilage, meaning there's already thinning of your cartilage. Stage three is when you have both a lot of bone spurs and decreased space. And stage four is when the space is completely obliterated and you have bone-to-bone contact of the joint. So it depends when you catch the arthritis. Most arthritic conditions become symptomatic or become painful when they are from grade two to grade three. So if you catch them early enough, yes, you can help your body regenerate cartilage, provided you correct all the other factors. And most common of these is your weight. So if your patient is already for surgery for arthritis, that means he or she is already grade 4. And no, sadly, Celergen uh, will not help regenerate that cartilage, which is not non-existent anymore. What Celergen can help with is the inflammatory process, which that can cause, which is also the underlying reason for the pain. So yes, the patient can feel better with Celergen, even with a grade 4 arthritis, but he or she still needs to address the other factors and maybe even have the surgery.
Thank you, Doc. Can you give Celergen to people with chronic kidney disease and what dosage?
Okay. Uh, it's safe for CKD patients, chronic kidney disease patients, to take supplements as long as your creatinine is within monitoring range. That means your nephrologist is watching your creatinine very closely. So when you start taking a supplement and your creatinine goes up, there's a trend that it's going up, then you have to back up. But you can start safely with the usual dose of once a day of Celergen. Yeah.
Okay, so how can you explain after taking Celergen, patients experience sleepiness, muscle pain, or stomach pain on her or his first 6 days on Celergen, sometimes even palpitations, and they have no issues on either gastro or heart prior to taking Celergen?
Okay, like any substance that you take in, it's not only the active ingredients you're taking in, you're also taking excipients, you're also taking vehicles with which the vitamin or the supplement was manufactured uh, for or on. So you can react to these other components, but the components that we mentioned as being the main ingredients of Celergen, they're practically safe. Like I said, having been prescribing Celergen for the past 15 years, I still have to see uh, a side effect that can really cause me to withhold it from my patients. Now, if you experience hyperacidity, maybe, or palpitations, which can also be caused by hyperacidity, then observe it over a week's time. So, I hopefully after the sixth or seventh day of taking Celergen, this will all quiet down. That's just your body adjusting to this new substance that you're giving it. But if it doesn't improve or doesn't go away, in fact, if it gets worse as the days go on after the sixth or seventh day, then yes, you may have to discontinue taking it.
Okay, so we'll go to our last 5 questions. Okay, we have, I'm just checking though. Okay, so here, my friend is suffering from detrimental effects after his third job of mRNA COVID vaccine, lack of energy, heart issues, emotional disturbance. Do you think Celergen can help in this case?
Okay, there's much to learn about our mRNA vaccines. Yes, it's true that we've been seeing a lot of new conditions in our patients who underwent uh, at least 3 or 5 vaccinations of mRNA. The problem is we don't fully understand what its effect is on our cells. Being an mRNA based substance or agent, we're not really very sure that it has no effect on our own genetic material. Your mRNA or your messenger RNA is the bridge between your genetic code, your DNA, and the protein making machinery of your cells, the ones that produce exosomes and even your hormones. So the effect of mRNA may have an effect on the manifestation or the translation of your genetic material in a way that was not there before you had the vaccine. So, number one, you have to look at the other factors first that we know, that we understand, before starting to blame um, the mRNA vaccine. Yeah.
Thank you, Doc. Next question is, can Celergen help in stroke recovery? And if yes, how many should they be taking?
Okay. If you have an illness across the board, we recommend 2 or 3 times a day of Celergen, and this is because we need to push your regenerative capacity ahead of your degenerative capacity. And yes, stroke is a process that entails degeneration, not only of your blood vessels but also of your brain tissue, which suffer the lack of oxygen because of the blockage or the bleed. So if you are recovering from a stroke or any illness or disease for that matter, then we recommend double dosing or triple dosing on your Celergen.
Okay, so will Celergen help with early onset of Parkinson's disease as well as ADHD, autism, mental health concerns?
Um, okay, so Parkinson's and all the other neurodegenerative diseases is caused by your brain not being able to repair the damage that it's undergoing. So considering that the basis of the action of Celergen is to help your cells repair themselves, then yes, it can help with neurodegenerative diseases, particularly early onset or early diagnosed or newly diagnosed neurodegenerative diseases. So this includes Alzheimer's, this includes Parkinson's, or even transient ischemia or transient strokes.
Okay, so down to last two questions, Doc. When is the best time to start Celergen? Is it too late after problems start?
Okay, the body repairs itself as long as we are alive, we're living and breathing. So it's never too late to fix your lifestyle. Okay, and of the major things that we can fix in our lifestyle: exercise, diet, and supplementation. Yes, supplementation can be very much started by taking Celergen. Yeah. If you want if I may share my personal protocol or experience, I take Celergen as my multivitamin or my base vitamin. And then if I need to, like maybe I notice some vitamin B deficiency, particularly for neuronal function, then I take vitamin B on top of Celergen. And if I have issues with my immune system, I take vitamin C and vitamin E and zinc on top of my Celergen. So that's how I manage myself, my supplementation protocol, and which is also what I recommend to my patients. Well, another example would be if you're osteoporotic, Celergen is your base multivitamin or vitamin, but you have to take calcium and vitamin D on top of that.
Right. Okay, so with that, we no more. Okay, so hold on, Doc. Okay. Some of the questions.
Well, most of the concerns were either autoimmune diseases or diseases of the immune system, and neurodegenerative diseases, which is a disease of the brain and central nervous system. So these diseases develop because your body is unable to repair itself. So it's always a race between degeneration and regeneration. When you start developing diseases, that just means that your degenerative processes are overtaking your body's capacity to repair itself, or your regenerative capacity. So look at things that way, and you would be guided on what to do in terms of lifestyle modification, supplementation. So that's probably what I can leave you with.
Thank you, Doc, for patiently answering all the questions, and thank you for those thoughtful questions. Okay. So if tonight's session sparked your interest and you would like to understand more about the products discussed, we encourage you to connect with the person who invited you. They will be able to guide you based on your specific needs. Now for those who would like to know how you too can be a part of this advocacy, this movement about staying active, staying young, there are vast opportunities to bring this into wherever you are. Then we welcome you to join us in our upcoming events. So we have upcoming sessions, the Entrepreneur Leap Seminar, or ELS. This is a business-focused session where you will understand how this opportunity works, how is it for you and I to be a part of this growing enterprise, and evaluate if it is something that resonates with what you want to be or what you want to do in the coming years. Okay, so for Singapore, our upcoming sessions will be held on March 28th from 10 o'clock in the morning to 4 o'clock in the afternoon. For those who are in Singapore or who may be traveling, this will be held live at the Avita Singapore Auditorium. And for those who are not in Singapore, this session will also be available via Zoom. This will be led by Platinum Director Christine Woon, Diamond President Mary Kwok, and hosted by Shali Dormitorio. So to register, you may simply scan the QR code on the screen. For the Philippines, we will also be holding a live ELS on April 25, 2026 at 1 o'clock in the afternoon up to 6 o'clock in the evening. And this will be held at the Avita Philippines office at the Glaston Towers, East Ortigas in Pasig City. Our speakers are Challenging Pearl Ambassador Jeannie Uy, Platinum Director Betsy Belmonte Gilbert, and it will be hosted by Platinum Director Lana Asherto. Again, to reserve your slot, you may simply scan the QR code on the screen or let us all meet together at the Avita office. So, and if this conversation has resonated with you today, this is simply the next space where you can explore it more clearly. So if you would like to better understand the product itself, we have an upcoming session titled Discover Celergen and What It Can Do for You. This will be led by Diamond President Xiong Peng. In this session, you will begin to understand what Celergen is, why it is trusted across different countries, and how it supports the body as we go through aging. We will not talk about theories here, but we will have a live sharing by people who have benefited from Celergen. So join us on April 9, 2026 at 7:30 p.m. at the Avita Singapore Auditorium, and let's discover Celergen together. So for those outside Singapore, you may also join via Zoom. And to register, you may simply scan the QR code on the screen. So for those who would like to go even deeper beyond product and beyond business, so we also have our industry expert seminar titled A Balanced Journey to Youth and Vitality, led by Professor Lin Chunying, Chinese Meridian and acupuncture specialist. So this session is more in-depth, focused on understanding the body through meridian health and essential oils. This will be on April 23, 2026 at 7:30 p.m. at Chiang's International Private Limited in Singapore. And again, it will also be available via Zoom with translation. So just simply scan the QR code to register. And as you can see, these are not just events. These are different spaces for different levels of understanding. You don't have to attend everything. You simply choose where you are ready to explore, because when understanding becomes clear, decisions becomes easier. So before we officially close, let's take a quick photo together. So may I request everyone to please turn on your cameras. Let me stop share. Betsy, you ready?
Yes.
All
right,
right.
it's going to take several minutes because there's several pages. Okay, ready? First one, smile. There you go. Thank you very
Thank you
much.
so much.
Once
Thank you,
again,
Doc.
thank you everyone for spending your evening with us. And thank you, Dr. Ben, for sharing your time and expertise. We hope tonight's session gave you not just information, but a clearer understanding of your health and what is possible moving forward. So have a wonderful evening, everyone, and we look forward to seeing you again in our upcoming sessions. Good night.
Thank you very much, Dr. Ben. Thank you.
Thank you.
Thank
Thank
you,
you,
Kat.
Kat.
Thank you, Dr. Ben. Thank you,
so
Kat.
much.
Thank you.
Bye, everyone.
Thank you.
Ben, God bless. Ben.
Thank you, Dr. Ben.
Anak ni Doc yun. Hi.
What an informative session tonight.
Amazing.
Amazing. Yeah. Thank you, Doc.
In spite of the busyness of Dr. Ben, he's here with us. So we really appreciate you, Doc Ben. Thank you so much.
Thank you. We appreciate all of you as well. Thank you for staying on.
Thank you, Doc.
Thank you, Dr. Ben. Doc, see you tomorrow. There you go.